main affection of phosphoric acid he says is on the mind. And because of that the nerves get exhausted. Then he writes it is an important remedy for metabolism and metabolic disorders. The sexual system is affected. The spines are affected. Even in the spine, more than the spine. What is affected mainly in the spine is what? Guess. Very good. Loudly. Bones. The vertebrae are affected basically. Okay. And then the subsequent symptom. And bones. Okay. So that is what he writes. How mind is affected, we will come to it later on. First, let us finish the body. Okay. So based on this understanding that we have up till now, now let us see the keynote symptoms of phosphoric acid. Keynote symptoms from bogus synoptic. They are weak or debilitated with free secretions. Yes or no? Why you get this symptom? Okay, very good. They are hyperactive, constant because of the phosphorus and acid element. So they will become weak and debilitated along with free secretion. Slowness. अभी तक क्या सीखा? Fast. Now what you see? Slow. Anybody can explain why? It is the end stage when you have completely now exhausted, nothing is left, and you are now zero. Completely exhausted. Very good. Pains go to parts laid on. Okay. So the part on which they lay on starts to pain. What is the one keynote symptom that is given in Allen's keynote of phosphorus in modality? It is written in bold. Students.
Aggravation lying on affected part.
Affected part also left side. Aggravation lying on left side. So phosphorus has what? Left-sided affections. So the one very important affection we learned along with calcarea of phosphorus. What was that? Lung affection. What? Left lung. Left lung is affected in phosphorus. So there is aggravation by lying on the left side. Okay. So should we go ahead? Then bruised, soreness, like growing pains. Why this? There is growing fast. What are growing fast? Bones. So this is a very common symptom in children. No, doctor रोज संध्याकाळी मला सांगतो पाय दाब माझे. This is very common symptom of growing pains. So in phosphorus, calcarea phos, these are all important. Phosphorus, calcarea phos, third remedy which is important. Calcarea ka, one more remedy which is very common for growing pains. Phosphorus, calcarea ka. One more important remedy is guaiacum. One more important remedy is guaiacum. Okay. Should I go ahead? Yes. Next symptom. Formication at roots of hair along spine and limbs. What is the main general symptom? सब साथ में. Main general symptom of phosphoric acid. What is it? Hyperactivity, complete exhaustion. Correct? Hyperactivity, complete exhaustion and destruction. Phosphoric acid is a very highly recommended medicine for hair fall after severe exhausting illnesses, for example typhoid fever. You understand why that symptom came? Why? Why hyper? Where is hyper? What is three symptoms you learned? Hyperactivity. Now first explain hyperactivity. in this symptom?
Step ladder fever.
Step ladder fever or high grade fever, constant fever like typhoid. Then what is happening? Followed by that? Whatever, due to some either loss of vital fluid, constant illness, exhausting illness, patient is going to lose all his energy. And then what will happen? Destruction. What does that mean? So what is going to happen in phosphorus is hair fall is not बाल टूट के गिर रहा है. Hair fall is like root से गिर रहा है. The root itself is falling down. It is falling down like that कि there will be no hair again coming there. Patient will become bald. So sudden hair fall. मतलब suddenly the eyebrows have fallen out. Suddenly eyelashes have fallen out. Suddenly patient has become completely bald.
So then what is the role of phosphoric acid?
It should stop, no? It should stop the hair fall. New may not come. Stop to karo. Okay. Loose joints. That is because of bone adhesion. Okay. Grows too fast. Okay. More than hyperactivity, it is affection of long bones. Okay. So keynotes from HCl. It is best suited to persons of originally strong constitutions who have become debilitated by loss of vital fluids, sexual excess, violent acute diseases, chagrin, or long-standing suppression of moral emotions, or as grief, care, disappointed affection. Originally, patient is strong and healthy, and then he becomes exhausted. This must be clear, no? Then it's where does that debility come from? It comes from loss of vital fluid. Say yes.
Yes.
Next, sexual excesses. Sexual excesses, because patient has lot of sex in one night, 2-3 times, 4 times, for 5 months, 6 years, 7 years, So the part becomes एकदम what useless. So another important symptom of phosphoric acid is impotence. Complete. मतलब अभी कुछ possible ही नहीं है. And it can't be recovered also. Sexual excesses. Then you have violent acute diseases. Okay, violent acute diseases. Yes or no?
Yes.
Next is chagrin. Now these are mental causes. So mental causes are chagrin or a long suppression of moral emotions, grief, care, or disappointed affection. See, what we learned up till now is that phosphorus or phosphoric acid, there will be intense activity, hyperactivity because of the acid. Due to phosphorus, where the hyperactivity will be?
Mind.
Mind. But where? For what? What we learned about phosphorus? Why is the hyperactivity there? Because they want love and affection. So that is what phosphoric acid hyperactivity is for. Is for gaining love and affection of the opposite person or opposite persons. It is not one. Persons. People around, as many friends, many relations. That is phosphorus. Multiple. What happens if due to some reason that person dies, or that person does not return affection? They feel a lot of grief, and from that grief arises his problems. Okay, we'll do this aspect in a little bit more details when we come to the mind aspect. Okay. For now, remember that. Next, ailments from care, chagrin, grief, sorrow, homesickness. Okay. One of the important symptoms is homesickness. Then you have sleepy, disposed to weep, night sweats towards morning. Okay. All this is because of the emotional grief, very weepy, sorrowful, grief, ailments from loss of care, love, affection, all that. Next is pale, sickly complexion. Eyes are sunken and surrounded by blue margins. This is clear? Why? Exhaustion. Because there is complete loss of everything. Okay. Next, in children and young people who grow too rapidly. 7 minutes. 7 minutes.
Yes.
Okay. Pains in back and limbs as if beaten. Okay. All that is because of bone affection. Next, headache. Headache, crushing weight on vertex from long-standing grief or exhausted nerves in occiput and nape of neck, usually from behind forward, aggravated by least motion, noise, especially music, ameliorated by lying down. See, phosphorus. There will be hyperactivity, intense activity, and second is it is important for growth. During growth, it is important for bone formation. But one more thing we learned about phosphorus is that it is very important remedy for metabolism. Correct? And because of the metabolism is affected, there is no energy production. Okay? Because there is no energy production, for phosphorus, the slightest movement, slightest exertion, more than movement, slightest exertion becomes a huge task. Because energy cannot be produced. ATP ही affected है ना इसमें तो. So ATP affected है तो वो हिलेगा क्या? They can't move. Slightest motion, there will be pain and exhaustion. So what is characteristic expression that we will find in patients is that doctor, I have profound exhaustion. बहुत थकवा, इतना थकवा ना, मैं थोड़ा चलूंगा ना एकदम दुखने लगता है और पूरा जान निकल जाती है, पूरा ताकत निकल जाता है. चलूंगा तो दुखेगा और वीक महसूस होगा. That is peculiar of phosphorus exhaustion. More than phosphorus exhaustion, it is not actually of phosphorus, it is peculiar of any kind of metabolic weakness where the metabolism is affected or ATP is affected. Are you getting me? Yes or no? Should I repeat? Huh?
Once.
Once.